there are risk factors
Certainly.
that for a UCL kind of injury, and we actually have a graphic that shows us what some of those injuries are, some of those risk factors. And if you can talk to us about that so we can know more about how to avoid a UCL injury.
I mean, if you look at the graphic, the bottom line between this is an overuse injury. So this is an injury that happens if somebody throws too much. You know, one of the things that USA Baseball has, or USA Youth Baseball does, is they have pitch counts for kids nowadays. So
Really?
Oh, yeah.
So what's a pitch count? Tell me about that.
So kids aren't allowed to throw a certain amount, depending on their age, how much they're allowed to throw over the course of a week. You know, and parents and players can be bad about this too, because it only counts for one league. So a lot of players will play in multiple leagues, and that's bad. You don't want to do that because you're putting your kid at risk for injury.
You're overexerting, yes.
Yeah, definitely.
So other risk factors are a player's weight, a three-season athlete versus a three-sport athlete, which we're going to talk about the difference with that. So are these other risk factors for UCL?
Oh, definitely. I mean, if you look at being a three-sport athlete allows a player to actually get rest. So if you play like the classic thing up north is, you know, you're a baseball player in the spring, in the fall you play either football or soccer, and then in the winter you play basketball or you wrestle. Doing those different sports gives you an opportunity to rest the throwing elbow and shoulder, so if you have any kind of thing going on, it gives a chance to get better. Because again, it's the motions of being a throwing athlete are a lot different than it is being a wrestler or being a basketball player. In fact, being a football quarterback, the throwing motion is different than being a baseball pitcher. So throwing a football is actually more of like a shot put. So it doesn't necessarily put the same stress on the ligament.